Hello and welcome to Spurbs Herbs, episode 103. Today we're going to be talking about Shān Zhā or Crataegi Fructus, commonly known as Hawthorn Fruit. This is one of my favorite herbs. So today we're going to be looking at that herb. This herb is in the Chinese medical category of herbs that relieve food stagnation. This is one of my favorite herbs used for reducing food stagnation, moving blood stasis and clumping, and stopping diarrhea, as well as potentially having a role to play in helping cardiovascular disease and lowering cholesterol. As usual, we will explore all the intricacies of this herb, as well as an explanation of its category. And as usual, we will be exploring something a little different. We will be looking at 4 worrisome Chinese herbs. Please stay tuned for another interesting episode. Before we do that, I just wanted to tell you that we have started and are doing an amazing special for our courses. If you use them for continuing education, professional development, or just for your own edification, we're offering 50 hours of courses for an unbelievable price. Normally this would cost $750. However, with the special code 50 CEUs, that's CEUS, this is going to be only $325 or $6.50 per hour. That is less than half off. That's considerably less than half off. Plus, and this is huge, you can get a free signed copies of one of my books. Just pay for shipping and handling. That is a free copy of Integrative Pharmacology, combining modern pharmacology with integrative medicine, or Playing the Game, a step-by-step approach to accepting insurance as an acupuncturist. Just go to the webpage www.integrativemedicincouncil.org/CEUS1. So that's Integrative Medicine Council, COUNCIL.org/CEUS1. For this amazing deal, and you get this amazing deal. Okay. If you're watching this live, next week I'm going to be doing one of my most popular courses, 9 Drugs and 10 Herbs to Worry About. Many years ago I wrote an article with a subset of the 10 herbs called 4 Worrisome Chinese Herbs. On this episode we will continue to revisit that article. We started that in our last episode. In the last episode we looked at evidence levels of research. Today we're going to dive into the 4 herbs. And if you want to learn about all 9 drugs and 10 herbs to worry about, check out my course at www.integrativemedicincouncil.org. Again, that's Integrative Medicine Council, COUNCIL.org, and you can check out live courses there and see all about it. So we will look at 4 herbs that may cause interactions according to these evidence levels that we talked about in the last episode. So we had A through D. This does not mean these are the only drug-drug interactions or even the worst interactions. It simply means that these are the interactions with the most evidence. There are many potential interactions that have not been investigated and may or may not be more serious than what appears here. First herb we're going to look at is Ma Huang or ephedra. Has been shown in numerous studies to cause interactions and harmful effects. This led to this herb being banned by the Food and Drug Administration in the U.S. in any prepared form. Well, this was probably an overreaction to political pressure at the time. There are some well-established dangers in the literature. Ephedrine, a chief component of Ma Huang, increases the incidence of side effects such as agitation, tremors, insomnia, blood pressure, heart rate, and in higher doses, plasma glucose, insulin, and C-peptide when combined with caffeine. And that is, have some level evidence there too. Oh, we won't get into that. Another study confirmed these effects, but noted the transient nature of the side effects. A well-constructed, randomly controlled trial showed that these negative effects were transient and equaled placebo levels after 8 weeks. In other words, we kind of get stabilized on it, get used to it. So these interactions are fairly well established. They seem to be for only a short while. When combined with methylxanthine, such as theophylline, which is an asthma drug, or caffeine, ephedrine may increase thermogenesis, an increase in the body's ability to generate heat, and weight loss. This may be considered a positive interaction except in patients who may not tolerate the increase in the sympathetic system. These patients include those with cardiovascular conditions. You're potentially taxing the heart. This interaction has been shown in many mice and human studies. I have them all listed here, so I'm waiting through them with my eyes. All right. Theophylline was one of the first drugs to treat asthma. It has largely been replaced by safer agents, but is still rarely used when other agents are not tolerated. Monoamine oxidase inhibitors, MAOIs, are primarily antidepressants, but some are used in treating symptoms of Parkinson's disease or Parkinson disease today. They include isocarboxazide, phenelzine, rasagiline, selegiline, and tranylcypromine. Based on the ephedrine content, Mahwang may cause hypotension when combined with MAOIs, according to an expert opinion. In one case report described a patient who stopped an MAOI, phenelzine, and ingested a combination pill of ephedrine, caffeine, and theophylline 24 hours later. She developed encephalopathy. It says here a problem with the brain. That's a serious condition of the brain. Neuromuscular irritability, tachycardia, so rapid heartbeat, hypotension, so lower blood pressure, rhabdomyolysis, a life-threatening condition of muscle breakdown, and hyperthermia, raised body temperatures. That's all pretty serious stuff. Other possible effects include arrhythmias, an irregular heartbeat, chest pain, hyperpyrexia or fever, and death. One human study showed an increase in cardiovascular symptoms. And Mahwang should be avoided for at least 2 weeks after stopping MAOI. So we do not want to be combining ephedrine with MAOIs. Because of ephedrine's potential for raising blood pressure, theoretically it should not be combined with agents that lower blood pressure. Ephedrine and pseudoephedrine toxicity may result from combining this herb with antacids. So that's Mahwang, lots of issues with that. Our next herb is Dongui, or Angelica sinensis. It has been suggested that Gansao, or licorice, may have phytoestrogen content. However, the jury is still out whether Dongui has estrogenic activity. I actually wrote an article after this article that pretty much found that it probably doesn't. Though, with science, it's a stepwise process. We may have a bigger study later that shows it does. One rat study showed significant estrogenic changes, while clinical research showed little or no estrogen activity. Finally, a double-blinded, randomly controlled trial showed no estrogen-like effects in postmenopausal women. So, based on that, I would say there is no phytoestrogenic activity in Dongui. However, it's postmenopausal women. We don't know in premenopausal women whether it does or doesn't. While there is some controversy, the preponderance of evidence suggests that there is no estrogen-like activity, at least in postmenopausal women. The evidence is still out on whether it may have these effects in other patients. Dongui has been shown in a small human study to potentiate warfarin, and caution should be used in combining these two. So that's our second worrisome Chinese herb. Our third one is Gansao, or licorice. We've already mentioned that. Gansao, licorice, and oral contraceptive pills may increase blood pressure and fluid retention, as shown in 2 case studies and an uncontrolled human study. Gansao has quite a reputation in the medical literature for increasing blood pressure. However, this is based on its Western herbal use as a single herb, and these effects may be mitigated by Chinese medicine's use of formulas. Because of this tendency, Gansao should not be combined with drugs that reduce blood pressure. It may also cause potassium loss when combined with diuretics. And finally, our fourth of our 4 worrisome Chinese herbs, Guanyi Yanqiao, St. John's wort, or if you're, we have Quite a few people signed up from Australia today. If you're from Australia, this is Hypericum. Affects a liver enzyme, cytochrome P450, which has led to being implicated in numerous drug-herb interactions. It was found to decrease the effectiveness of indinavir in a small human study. Indinavir is an antiretroviral agent used in treating the human immunovirus, HIV, and acquired immune deficiency syndrome, AIDS. And a reduction in its effectiveness could allow advancement of the disease and can be life-threatening. B-level evidence, so pretty high-level evidence, showed a significant interference between Guanyin-Lianchao and digoxin, which is used for arrhythmias, and used less and less. There's a lot of issues with digoxin, but it's still used occasionally. Guanyin-Lianchao is also considered to act like selective serotonin reuptake inhibitors, SSRIs, antidepressants, and should not be combined with any type of antidepressants. If you combine it with almost any types of antidepressants, there's one type, dopamine reuptake inhibitors, where it probably would not be an issue, but all other types of antidepressants involve serotonin, and there's something called serotonin syndrome that can happen if you have too much serotonin. And so we generally don't combine antidepressants, so not a good thing to do. And since Guanyin-Lianchao is an SSRI, not good to add into that. Well, these are not the only herbs that should be carefully administered with drugs. They are among the most researched and accepted. Of course, combining drugs with these herbs can be dangerous. Only a very few case studies have shown them to be. In other words, be cautious but not paranoid. Use a step-by-step approach to combining drugs with these herbs, and there is little to fear. But that is another discussion. Right now, let's get into a discussion of today's herb. And here we are. We have another herbal legend from Zhu and Zhu. So without further ado, on a mountain lived a family who owned some land on its slope. There were two sons in the family. The elder son's mother had died, and the younger was born to the second wife. The stepmother regarded the elder boy as a thorn in her flesh. She wished to kill him so that her own son could have all the family property. But how? She couldn't kill him with a knife, nor push him into a river. Thinking about this again and again, she came up with a cruel plan to make the boy ill and then die of illness. It happened that the boy's father was going away on business. When he left, he told his sons to obey their mother. There's so much to do in our household. You'll have to work, the woman told the elder boy as soon as her husband left home. What do you want me to do? Asked the boy. Since you are young, you can go guard the fields. I will cook some food for you to take with you. From that time, the elder boy stayed out in the wind and rain, looking after their crops every day. His cruel stepmother deliberately made half-cooked food for him every day. The boy was very young. How could he digest such food every day in the wild fields? As time passed, he began to have stomach trouble. Sometimes he suffered from stomachache, and sometimes from swelling of his belly. He grew thinner and thinner. "Mummy, these days my stomach aches a lot immediately after I eat the food you cook for me," said the boy. "You have only done a little work, but you can complain about the meals? Humph! There's nothing but this for you to eat." The boy didn't dare argue, so he sat on the mountain weeping. On the mountain, there grew a lot of wild Shān Zhā. Since he wouldn't eat the half-cooked food, he ate a few Shān Zhā instead. Because he felt that it allayed his hunger and quenched his thirst, he began eating it every day. After a while, not only was his belly swelling gone, but also his stomach ache stopped. He could now digest whatever he ate. His stepmother was very surprised. "Why hasn't the fellow died? Why is he growing fat instead? Has a god protected him?" she wondered. So, she gave up her evil plan and no longer dared try to eliminate the boy. Later, the boy's father returned home. The boy told him about his experience with Shān Zhā. His father was a shrewd businessman, and so began to make medicine with Shān Zhā and sold it to patients. Over time, it was found that Shān Zhā could invigorate the spleen's function and be good for the stomach, promote digestion, and reduce swelling. That is the herbal legend around Shān Zhā. So let's talk some specifics about Shān Zhā, or hawthorn fruit. It's from the family Rosaceae, which is a very common family, and we're going to talk about that in just a moment. Standard species include Crataegi Fructus, and it says BGE. Again, that refers to the biologist who classified it, and that's normal Shān Zhā. We have Crataegi Fructus variant major, is what it's called, and this is Shan Li Hong. We also have Crataegi cuneata Sib et Suk. Again, these are the biologists, and this is Ye Shān Zhā. So that's the three standard species. Medicinal part is the fruit, and the English translation is mountain hawthorn. Other names include Crataegi fruit, hawthorn fruit, Chinese hawthorn, Da Shān Zhā, Dong Shān Zhā, Hong Guo, Jiao Shān Zhā, Shān Zhā Tan, Shān Zhā Li, which is specifically referring to the cuneata version, Swan Mei Zi, Xuan Zha, and in Japanese and Korean it's the same, Sansa. I don't know how to pronounce Japanese or Korean. It's spelled exactly the same, Sansa, S-A-N-S-A, in both Japanese and Korean. And there are lots of different species of hawthorn, and a lot of the science, a lot of the research papers I saw just talked about Shān Zhā, all the species of Crataegi as hawthorn fruit, and so they didn't differentiate between different species, which is interesting. So in this case, these are probably different species of hawthorn, but may have similar effects, including manzanita, maybush, maythorn, and Mexican hawthorn. So there you go. So let's talk about the Rosaceae family. The Rosaceae, or rose family, is a medium-sized family of herbs, shrubs, and trees in the order of Rosales, comprising 4,828 species in 91 genera. Many edible fruits are in this family, including apples, pears, quinces, apricots, plums, cherries, peaches, raspberries, loquats, strawberries, rose hips, hawthorns, which where we are today, and almonds, as well as many ornamental trees and shrubs. Most are deciduous, though some are evergreen. While they are present worldwide, they are particularly diverse in the northern hemisphere. So that's the Rosaceae family. Going back to Shān Zhā, Bensky and his team. So remember, when we talk about individual herbs, we have three major textbooks, as well as several other textbooks that we look at. The first of that is Bensky and their team. They are the ones who wrote Chinese Herbal Medicine Materia Medica, and this is the third edition. They say the dosage is 9 to 12 grams. Our second textbook by Chen and Chen say 10 to 15 grams with a maximum of 30 grams. And Brand and Wiseman, which they wrote the Concise Chinese Materia Medica, also say the dose is 10 to 15 grams with a maximum of 30 grams. Categories. Bensky and his team puts this herb in the herbs that relieve food stagnation category. Chen Chen say it is in the digestive herbs category. And Brandon Wiseman say it is in the food dispersing medicinal category. So they're all variations of the same thing. All three texts, and this is not all that usual, all three texts agree on all the properties of this herb. It is sour, sweet, and slightly warm, and enters the liver, spleen, and stomach. So that is the properties of these herbs, of this herb. Both Bensky et al. And Chen agree the original source for this herb is the Bensao Jingji collection of commentaries on the classic of the Materia Medica by Dao Hong Jing, written in 494 CE. So that's a couple hundred years after our first existing book on individual herbs, the Shennao Bensao Jing. So relatively early still in Chinese medical history, but not the earliest. So let's talk about this category, herbs that relieve food stagnation. Bensky and his team has a great introduction to this category of herbs. The actions of this group of herbs reduce or dissolve Shao and guide out Dao. These terms refer to their ability to reduce, dissolve, or digest food stagnation and to guide out accumulation G through the digestive tract. An accumulation is a disorder characterized by an abdominal mass, distension, and or pain. It is often caused by an emotional disturbance which results in stagnant Qi or blood, but can also arise from improper dietary habits, phlegm, or hot and cold disorders. Because accumulation disorders often manifest as stagnant Qi in the middle burner, the herbs in this group are usually combined with others that regulate the middle Qi. Food stagnation is generally subdivided into hot and cold types. The principal manifestations of the hot type are severe bad breath, a feeling of distension in the abdomen, a preference for cold food and beverages, and an aversion to hot ones, a yellow, greasy tongue coating, and a forceful, slippery pulse. This condition usually arises with either externally contracted diseases or heat from constraint. In such cases, herbs that clear heat are also prescribed. The cold type of food stagnation is due to spleen or stomach deficiency or ingesting too much cold food. Major symptoms include a brackish feeling in the throat, nausea, spitting up clear fluids, a feeling of distension in the abdomen, preference for hot food and beverages, and aversion to cold ones, a white, greasy tongue coating, and a weak, thin pulse. For this pattern, herbs that warm the interior are added to the prescription. If the food stagnation is severe, purgatives may also be required. So good quality. What is good quality of this herb? Bensky and their team say good quality of the northern variety consists of large fruit or slices with a red or reddish-brown surface and fleshy pulp. Good quality of the southern variety consists of reddish-brown fruit, uniform in size with thick pulp. Because the northern variety is more sour, it is considered to be of superior quality. Then here's one of our other textbooks that I said we had. This is Chinese Medicinal Identification and Illustrated Approach by Zhao and Chen, and edited by Eric Brown, who is one of the co-authors on Brown and Wiseman textbook. I love this Chinese Medicinal Identification and Illustrated Approach because it very clearly describes things you want to look for good quality. It's very specific, has beautiful pictures, which I can't share, of course. But they say Shān Zhā has round slices, wrinkled and uneven, red outer skin with wrinkled lines, with a clear, fresh aroma, and a sour and slightly sweet taste. Superior grade medicinal material consists of large slices with red skin, thick flesh, and small seeds. And it has something called persimmon lips, which refers to the apex of genuine Shān Zhā has remnants of a persistent calyx that is indented in the center, creating an appearance similar to the persistent calyx seen in a persimmon. That's what's called persimmon lips. I love the names that they put on some of these signs of good quality. So there you go. That's Chinese medicinal identification. What are its Chinese medical actions? So according to Bensky, Shān Zhā reduces food stagnation and transforms accumulation for accumulation due to meat or greasy foods with abdominal distension, pain, or diarrhea. Transforms blood stasis and dissipates clumps for postpartum abdominal pain and clumps due to blood stasis. Also for bulging disorders. It stops diarrhea. The partially charred herb is used for the diarrhea of chronic dysentery-like disorders. Also recently used for hypertension, coronary artery disease, and elevated serum cholesterol. So it seems very helpful for cardiovascular stuff. We'll see what the science says in a little bit. Chen say it promotes digestion, eliminates stagnation, activates blood circulation, disperses blood stagnation, and treats cardiovascular disorders. And Chinese medicinal identification illustrated approach says it disperses food, fortifies the stomach, moves qi, and disperses stasis. And that leaves us with our other major textbook, Brandon Wiseman, who say it disperses food and transforms accumulation. Food accumulation and stagnation due to excessive consumption of meat and fat. Quickens the blood and disperses stasis. Postpartum abdominal pain due to stasis obstruction. Persistent flow of lochia. Painful menstruation. Moves qi. Dysentery with abdominal pain, painful mounting, Shan, qi. Those are just descriptions of what it can move, the dysentery. In modern application, Shān Zhā is frequently used in its raw form for the treatment of hypertension, hypercholesterolemia, and coronary heart disease. Hypercholesterolemia is too much cholesterol in the blood, and coronary heart disease as well. For preparations, Bensky et al. Describes 3 preparations for this herb. Dry fried Crataegi or Shan Zhā. Fruit is dry fried using moderate heat until the outside turns pale yellow. If high heat is used, it is heated until the outside becomes a scorched brown and the inside turns brownish yellow. Dry frying or scorching enhances the ability of the herb to reduce food stagnation and guide out obstruction, and endows it with the ability to stop diarrhea. Thus, it is often used for obstruction in the spleen and stomach due to overheating coupled with diarrhea. So that's dry fried Crataegi, Shān Zhā. Prepared Crataegi or Shan Zhā. The fruit is mixed with honey or sugared water, then dry fried until no longer sticky to the touch. This method of preparation relies on the sweetness to prevent injury to the blood or normal qi that might otherwise occur as the herb transforms blood stagnation and guides out obstruction. And then there's carbonized Crataegi or Shān Zhā Tan. The fruit is dry fried over high heat until carbonized but not deformed. This is also simply known as Zhā Tan. Its blackness enables it to more easily enter the blood level to transform stagnation and also halt bleeding. And thus it is often used for postpartum abdominal pain, prolonged lochia, and red dysenteric disorder. Those are our 3 preparations. What are its Western uses? Is this a Western herb? The species that are commonly used in Chinese medicine, called Shān Zhā or its variations, appear to be exclusively Chinese traditional herbs. The PDR for Herbal Medicines does not mention this herb specifically, but does discuss English hawthorn or Crataegi levigata, so a different species. They say Crataegi is a well-studied herb for use in cardiovascular disease. Historically, it has been used for congestive heart failure, commonly in combination with cardiac glycosides, as it may potentiate their effects, thereby reducing the dose. And cardiac glycosides are not super safe drugs, so if we can reduce the dose, that's a good idea. It is approved by Commission E for decreasing cardiac output. That's huge. Well, it was huge. I don't know if it still is. But Commission E is from the European Union, and basically they've looked at the science and says, hey, there may be something here. And interesting, they do discuss this herb as a Chinese herb. So I think this is a different species, like I said, of the hawthorn that we use, but they do have a specific say this is used as a Chinese herb. So I'm referring to the English hawthorn. So again, as opposed to many other herbs, there doesn't seem to be like a lot of difference. Like people tend to clump all the different species of Crataegi into one and then kind of say they all kind of do similar things, which is very different than I see with most herbs species, because one species is not like another species in general. So it's kind of interesting. I'm not sure exactly what to make of that in general. It also has an entry on WebMD, which is not a bad source for looking at the Western side of these things. But again, it kind of says similar things to what we've been talking about, and I'm just saying this as a potential, it said all the same sort of things about what it does or doesn't do. And so I'm kind of putting that, WebMD has some of the major Chinese herbs, but tends to be a little bit more Western herbally oriented. So the fact that it has it is a little bit on the Western side. So I guess to me it doesn't seem like there's a clear distinction between Western and Chinese herbs, uses of these herbs. There do seem to be different species, but the species seem to have similar effects, whether it's Western or Chinese side effects that we're talking about. Let's talk about some commentary here. Bensky et al., as usual, has an excellent commentary on this herb. Sour, sweet, and slightly warm, Crataegi Fructus, Shān Zhā, awakens the spleen and binds the stomach, promotes food intake, and assists digestion. It is particularly useful for problems due to overindulgence in meat and greasy foods. For this purpose, it can be used alone as a decoction. It stops diarrhea and dysenteric disorders. It also enters the liver channel blood level to disperse stasis, invigorate the blood, transform clumps, and reduce distension. In this way, it treats food stagnation, epigastric and abdominal distension, childhood nutritional impairment, watery diarrhea, and dysenteric disorders. Because it invigorates the blood, it is also used for amenorrhea, absence of menstruation, abdominal masses, blood stasis following parturition after giving birth, and prolonged lochia. In Essays on Medicine Esteeming the Chinese and Respecting the Western, the Shi Shui Zhongzhang San Shi Lu, written from 1918 to 1934, Zhang Shi Chun explained that this herb has the most sour flavor, is slightly sweet, and is neutral in nature. Its skin is red and its flesh reddish yellow. Thus, it excels at entering the blood level as an important herb for transforming stagnant blood. Because its flavor is sour but slightly sweet, it tonifies and assists the acid juices within the stomach. Thus, it digests food accumulation and is particularly good for digesting accumulation of meat. Its power to transform stagnation especially eliminates blockage and stagnation within the intestines, which is causing the passage of blood and pus in dysenteric disorders. And it also enters the qi level to open constrained phlegm clumps and treats pain in the heart and abdominal regions. If assisted by sweet herbs, it transforms static blood but does not injure newly generated blood, and opens constrained qi but does not harm the normal qi. Its nature is especially harmonious and calm. So that's the Bensky commentary on Shān Zhā. Chen and Chen also has some authors' comments about this herb. According to Dr. Liu Hongxiang, Shān Zhā, when used in high doses for postpartum pain, constricts the uterus and helps dispel residual blood clots that cause continued bleeding. According to Dr. Zhang Xiaoping, Shān Zhā effectively lowers cholesterol, but is not suitable for individuals who have stomach ulcers. Shān Zhā, Zisuye folium perilla, Shirchangpu rhizoma acori, and Zeshe rhizoma alismatis, taken as a tea on a daily basis, are effective to reduce body weight and lower cholesterol. So there you go. There's a great weight loss tea right there. For patients who have stomach ulcers or gastric hyperacidity with high cholesterol, the practitioner should opt for other cholesterol-reducing herbs that are not sour, such as Jui Mingzi or Semen cassia. Shān Zhā and Lifudza, Semen rafani, share similar actions to promote digestion and eliminate stagnation. Shān Zhā more effectively promotes the digestion of meat. It also invigorates blood circulation and eliminates blood stasis. Lifudza treats abdominal fullness and distension caused by food stagnation and accumulation. It also eliminates phlegm and directs abnormally rising qi downwards. Shān Zhā, Maya, Fructus hordeae germinatus, and Shenchu, Massa fermentada, have similar yet different functions to promote digestion. Clinically, they are commonly charred and used together to treat food stagnation and indigestion. Shān Zhā is best for food stagnation due to excess intake of meat. Are we getting that drummed into us? This is about meat. This is great for food stagnation. It is also good for palpable masses and blood stagnation in the abdomen. Maya is best for food stagnation caused by inability to digest starch. And Shan is the most strategic choice to counter hard-to-digest foods in general. There's a little bit of comparison of herbs there, but let's get into some more specific comparisons. Bensky and their team compares this herb to Gidgerae, Gali, Endothelium corneum, or Jine Jin, also known as also chicken gizzard lining. So both herbs strongly reduce food stagnation. However, Crataegi Fructus Shān Zhā tends to reduce accumulated blockage due to overconsumption of meat, while also breaking up qi and dispersing blood stasis. It is therefore also appropriate for disorders such as amenorrhea, bulging disorders, and chest pain due to obstructive stagnation. By contrast, Gidgerae, Gali, Endothelium corneum, Jine Jin treats all types of food stagnation and is a fine herb for strengthening the stomach, while also halting enuresis or bedwetting and dissolving stones. So that was our comparison. Let's talk about some combinations. Bensky and their team combines this herb with two others, Masa medicata fermentada or Shan. We've mentioned that a few times at this point. And Hawthorn Fructus germinatus Maya, we've talked about that a couple times as well. Together, these are known as the three amores or sanxian, a term used directly in prescriptions. This is a very common combination used for food stagnation due to overeating, which leads to qi stasis and such symptoms as belching, epigastric and abdominal distension and discomfort, as well as diarrhea, loss of appetite, and lethargy after eating. There are practitioners outside of China who include this combination in many of their formulas, believing that the modern diet predisposes most patients to food stagnation, which can interfere with the efficacy of herbal treatments. Chen and Chen discuss a couple of combinations of Shān Zhā with other herbs. Jiao Shan San Xian, three charred miracles, is the shorthand name for the combination of Shān Zhā, Fructus Crataegi, Shenchu Masa fermentada, Maya, Fructus Hawthorn germinatus, all charred. So it's basically the same thing as we just read about from Bensky, but this is charred. When charred being long, semen ericae, is added, the combination is called Jiao Si Shan, or four charred miracles. These herbs are often used together because they have excellent synergy to promote digestion and eliminate food stagnation. Contents. So, according to Bensky and his team, the contents of this herb include flavonoids, including quercetin and rutin, which are their own supplements at this point. Those are concentrated and sold as supplements in and of themselves. Organic acids, hydrocarbons, and tannins. Chen and Chen discussed the following constituents: crataegic acid, maslinic acid, chlorogenic acid, vitexin, hyperin, epicatechin, amygdalin, quercetin, ursolic acid, tartaric acid, caffeic acid. Zhang et al. Say it is rich in amino acids, minerals, pectin, vitamin C, chlorogenic acid, epicatechol, and choline. So interesting, different emphases on what are the contents here. Now, we've talked about some of these. I mean, quercetin and rutin I've talked about in my integrative nutrition series, which they're interesting supplements. I'm not going to get into all that right now. I think the epicatechin is similar to what's in green tea, so that's interesting. The fact that it has pectin in it probably has a good amount of pectin. Pectin has been found to lower cholesterol levels, so we start to see how this might be working on the body and how it can be effective. But let's look at the science. Let's see what the science says about it. According to Chen and Chen, the pharmacological effects of Shān Zhā include being cardiotonic, so helping the heart, vasodilating, which means it opens the arteries, and the vasculature in general, antihypertensive, so it lowers blood pressure, antihyperlipidemic, so it lowers cholesterol in the blood, and antibiotic, so it actually can treat infections, bacterial infections. These effects were all demonstrated in small animal studies or bench research. In other words, not in humans, so we don't know if this actually does this in humans. So let's look at some of the human trials, because they also discuss a few clinical studies with positive results with Shān Zhā. One study of 219 patients with angina, so that's chest pain, which happens with cardiovascular disease, so that is indicative that can be very helpful for that. 2 studies used Shān Zhā to treat hyperlipidemia, one with 127 patients using Shān Zhā and Maya, which we talked about quite a bit, Fructus hordeae germinatus, and the other with 130 patients using a formula containing Shān Zhā. So I think there's some evidence that this is helpful for hyperlipidemia, or the current name is usually more dyslipidemia. And so I think this can be very helpful. My overall sense of Shān Zhā and use for helping lipidemia is that it is a good piece of the puzzle, but I wouldn't rely on it alone to reduce lipidemia, hyperlipidemia or dyslipidemia in the blood. There's other herbs that I combine with that. I love red yeast rice, and that I've had another Sperps Herbs episode on. That's a great one to lower lipidemia, the lower cholesterol in the blood. But I would think of this as a piece of the puzzle, but not the whole. I wouldn't use this alone to do that. Shan continues to discuss case research studies. 100 patients were treated for acute bacterial enteritis, so that is a bacterial infection of the intestines. Infantile diarrhea in 212 infants. 60 patients used a formula containing Shān Zhā to treat chronic and acute nephritis. That's kidney disease. Fresh Shān Zhā was used to treat chronic nausea in 85 patients. And 10 patients, so not statistically valid, still an interesting use, 10 patients were treated for vocal cord polyps. So that's an issue. Remember, this it disperses accumulation, so a polyp would be considered an accumulation in Chinese medicine. So interesting use of this herb for that. I did find several reviews of the actions of Crataegi and specifically Shān Zhā, which is great because usually I don't find review research and studies. So I'm going to talk about a few of them here. Cloud and their team concluded this systematic review found that Hawthorn can significantly lower blood pressure in people with mild hypertension if applied for at least 12 weeks. Shang and their team summarized there is convincing evidence from both in vitro and in vivo studies. So in vitro means in glass, so test tubes. In vivo means in live people, so that not necessarily people, but in live subjects. Usually in vivo is animal studies, and then we have clinical studies, which are usually in people. So there's convincing evidence from both in vitro and in vivo studies supporting the traditional uses of seed penetifida, which is our Shān Zhā. However, multi-target network pharmacology and molecular docking technology should be used to study the interaction between the active ingredients and targets of C. penetifida. So, most of these reviews will say more research is necessary, and that's what that last sentence is all about. It's like, we need more study, which is fine. No matter how strong the review is, they will always say, and we need more, sort of thing, too. Anyways, moving on. Wu and their team, as part of their conclusion, says the cardiovascular activities and clinical implications of hawthorn extracts have been extensively studied. Current evidence shows its potential as a phytotherapeutic agent adjuvant in conventional management of coronary heart disease. In other words, it can be useful as an addition to conventional management of coronary heart disease. So that's good. This is a good stuff. Another, and I'm going to say not very strong review from Degani and their team concluded, from the data collected, we can conclude that C. penetifida has a vast array of effects on factors contributing to the formation of metabolic syndrome. It can be beneficial in diabetes, obesity, hyperlipidemia, and atherosclerosis. Active components in leaves, fruits, and seeds are responsible for its pharmacological effects. The inhibition of ACAT and HMGR enzymes, reduction of platelet aggregation, and reducing lipid inclusions in the liver have been noticed as main mechanisms that are involved in beneficial properties of C. pennitifida. Finally, a good meta-analysis states, in conclusion, these results suggest that there is a significant benefit from hawthorn extract as an adjunctive treatment for chronic heart failure. Overall, I think there's probably enough science to say this might be helpful with cardiovascular disease. Having said that, if someone's using this in terms of cardiovascular disease, then we need to be even more worried about drug-drug interactions. So let's talk about drug-drug interactions, because they're going to be using it as an adjuvant, so they're going to be on the normal drugs, so they're going to be adding in this herb into a drug regimen. So Shān Zhā may attenuate the action of cardiac glycosides, though the cited small human study showed no significant interactions. Okay. The literature search does not show any cytochrome P450 or P glycoprotein interactions. And the American Herbal Product Association Botanical Safety Handbook puts this herb in interaction class A, herbs for which no clinically relevant interactions are expected. So it seems pretty darn safe for drug-herb interactions. This talks about cardiac glycosides, but I've got to be honest with you, cardiac glycosides are so touchy. I would never, ever give herbs to a patient on cardiac glycosides. That just, we talk about warfarin as being a major drug-herb interaction thing. The cardiac glycosides, to me, are an order of magnitude worse than that. I would never do herbs, cardiac glycosides. With warfarin, I have done, and I would do under specific circumstances. I'm not suggesting I do it willy-nilly, but I have put herbs into warfarin. I would never do herbs into cardiac glycosides. But there are concerns, so let's talk about some of those concerns. So Bensky and their team note several concerns with Shān Zhā. Under the heading of cautions and contraindications, they say, use with caution in those with weakness or deficiency of the spleen and stomach. Large doses are absolutely contraindicated during pregnancy, as this can lead to fetal death. Okay. Under the heading of traditional contraindications, they say its nature conquers and cuts down. If stomach patients have no food accumulation, or if the spleen is deficient and cannot transport and transform, or those with no appetite consume it, it will conversely conquer and curtail the generative chi of the spleen and stomach, causing restless irritability and an increase in hunger. If the spleen and stomach are deficient, but there's also accumulated stagnation, it should be used together with herbs that tonify the chi, but should not be overly used. It can also injure the teeth. And this is from Harm and Benefit in the Materia Medica, the Bensal Haili, by Ong Huan, written in 1893. And I have a question here. Define the large dose, please. Now remember, we said earlier the dosing that there's a maximum of 30 grams. So I would consider, the traditional is about 9 to 12 or 10 to 15 grams, depending on the source. So I would say a large dose is anything over 15 grams. That would be my guess. That would be my definition of a large dose. Yeah, good question. Thank you. Chen had some concerns, also had some cautions, contraindications about this herb. Shān Zhā should be used with caution in patients with spleen and stomach deficiencies, because Shān Zhā may stimulate the production and secretion of gastric acid. Should be used with caution in patients who have gastritis or peptic ulcers. Prolonged intake of Shān Zhā is not recommended, as it will eventually interrupt the normal flow of spleen and stomach qi. Brown and Wiseman have a similar warning: used with moderation in spleen stomach vacuity. And the American Herbal Products Association Botanical Safety Handbook puts this herb in safety class 1, herbs that can be safely consumed when used appropriately. So when you use it appropriately, we're probably pretty good. There was a review article just on the adverse effects of Crataegi, which discussed the frequency of adverse effects with gastrointestinal complaints, dizziness, vertigo, palpitations, headache, and migraines being the most frequent effects in order of frequency. They finished by saying, in conclusion, all data reviewed in this article seems to indicate that Hawthorn is well tolerated, even if some severe adverse events were reported. This suggests that further studies are needed to better assess the safety of Hawthorn-containing preparations. Moreover, the unsupervised use of this drug can be associated with problems, especially if given with concomitant medication. So that's the normal sort of conservative boilerplate, like, hey, it seems pretty safe, but we still need to do more research. So that's kind of normal in those kind of reviews as well. All right, I think we're wrapping things up here. Today we start with our discussion of 4 worrisome Chinese herbs. Then we looked at another single Chinese herb, Shān Zhā, Crataegi Fructus or Hawthorn Fruit, from herbs that relieve food stagnation. Tasty and useful herb that may be very helpful for cardiovascular diseases in addition to digestive complaints while appearing to be quite safe. As usual, we explored all the intricacies of this herb as well as an explanation of its category. What a fantastic exploration of a very helpful and important herb. I really like this herb. And after doing this, I go, I gotta have more of this in my. If I used to get Haw Flakes, I don't know if you're familiar with Haw Flakes. Those are it's a candy made out of Fructus Crataegi. And they're little thin discs that you eat. And I got off of them basically because I realized they're probably more sugar than they are Fructus Crataegi Fructus, Shān Zhā. So probably I don't need the sugar. But those are supposedly have some of this in there. And but like I said, I think it's mostly sugar. So used as not really as an herbal thing, but I guess what they would say is it's kind of a herbal adjacent candy would be the way I would say it. Our next episode will explore another herb of the world. We're going to be looking at stevia or Stevia rebaudiana, known for its sweetness, but are there other medicinal properties? We're going to find out as we do our usual deep dive into this herb and find out if there is any evidence or concerns. And as usual, we will be adding something a little different. It's going to be another daunting trek into the unknown. Well, it is actually known, but we're still going to trek, and it's still daunting. So please join us in 2 weeks for the daunting trek into the known, I guess would be the better way to say that. Thank you. Thank you. If you like this podcast, please do us a huge favor, subscribe in your favorite podcast app. We really appreciate that, and we thank you for even considering it. Don't forget our amazing continuing education deal at integrativemenicincouncil.org/CEUS1. If 50 hours sounds like a lot, there's another deal with half that amount and still a fantastic deal. So go check out that page. And you can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. Thank you very much. And as usual, today I have a huge bibliography. Thank you very much. Oh, I'm still going. Hang on. Now I can say thank you.